Now we wait to have 2 negative responses from the semen analysis before you can stop other forms of contraception. I'll give you the details after the operation, and I'll give you the specimen jars, and I'll tell you where to go, Monklands Hospital, and your responsibility is get those specimens to hospital, and then I will tell you the results. A word of warning: 40% of the men do not carry out this test. Now, I always think it rather illogical that fellows go through this operation, then they don't get the test afterwards. I suspect they hide it from their wives because they're the ones who are most concerned about the results. So, follow advice and get the tests done. Having said all that, and the necessity of getting the semen analysis carried out, I cannot give you 100% guarantee of this operation working. It's the safest and form of contraception that we know. It's the most reliable form of contraception we know, but it's not 100%. Very, very rarely you get a little sperm escaping down the one tube that's been tried to be blocked off, and it works its way down to the other end of the tube and it can escape. However, the kind of research papers that check up on those things give percentages of between 1 in 800 cases to 1 in 4,000 cases. The average is round about 1 in 2,000 cases which do fail. If you still keep producing sperm by some means or other, then it's a straightforward case of you deciding whether you want the operation repeated or not. But we discuss that obviously at the time if it's appropriate. Now, a few words about the actual operation, because it helps you to understand what I'll be doing at the time. First of all, we put in the local anaesthetic, and that's into the soft skin, as I've explained to you, at the scrotum. Now, it's not the bottom end of the scrotum, it's the top end of the scrotum near the penis. Once that skin is frozen and the inside tubes are frozen, then I can do a little cut in the skin, which is less than 1 centimetre long on either side. Through that little cut I can put in a little forceps. I take out the little tube, which looks like spaghetti, and then I can squeeze that tube, squash it with 2 forceps. And then from the bit in between I take out a piece of the vas deferens, and so I leave a gap, and that gap's nearly 1 centimetre. That little piece I take out, I send it off to Monklands laboratory, and they double check that that is indeed the vas deferens, and I've done the job. Now, the little tube that's left, at either end I put 2 little ties of silk at that end and 2 little ties of silk at that end, and then I use a diathermy to diathermy the very end and the very end of the other side. That diathermy causes a little puff of smoke, and there's a little smell which I describe as beef burger smell, just because it's a little bit like burnt skin. And then you might smell that, but don't, I mention it so you don't worry about it. It's all part of the process, and it's indeed a very important part of the process to try and seal the end of the tube and stop the sperm escaping. After that, check the bleeding settle down, then I simply put a dissolving stitch in the skin so that that stitch dissolves. It doesn't need to be taken out unless it becomes very stubborn, and it'll come out in a week or 2 afterwards. So that essentially is the operation. You might need some post-operative painkillers like paracetamol, cocodamol, ibuprofen, and wear the supportive underwear, and you'll feel reasonably comfortable. The anaesthetic lasts 2 or 3 hours, so you'll be able to drive back home without any difficulties, get home by other forms of transport if need be. Now, I hope you'll be able to come with your wife or partner, and they can discuss with me and bring up any questions as indeed you can before we actually do the operation. The time it takes, the appointment is 3/4 of an hour. The time of the operation is about 10-15 minutes or so, so it's not a long process at all. A little word about activities after the operation. I'm often asked, and my best advice is don't do any sports for at least a week after the operation. I mean, you could do sports, but if you have an accident and you get hit in the wrong place, it is agony. And so, why take the chance? You may as well just have a more comfortable time for a week until things settle down and you get on with the sports afterwards. The other thing is don't have a long soak or go swimming for a week, because that may open up the little wounds in the skin and they're more likely to get a wound infection into it. So I hope you found all that helpful. Keep your questions for when you see me. Make an appointment by ringing my secretary and you reserve that time which is convenient for you. Now, if you do change your mind or circumstances changed and you may get ill or whatever and have to postpone or cancel the operation, do that as soon as you possibly can. That's helpful to us so that we're not wasting our time and another patient can be brought in early if possible to have their operation carried out, rather than for us to sit and twiddle our fingers waiting for another patient to come. So hope to see you in the next month or two, and bring your questions then and we'll go into further details if you need it. Goodbye.